Let's now go to Gua Sha. Let's discuss abdominal distension. It is the most commonest symptom of abdominal discomfort due to abdominal fullness, which takes place in many kinds of illness. Here, it purely refers to illness of intestinal and gastric functions, excluding such diseases of internal and surgical departments of intestinal obstruction, tumor, liver cirrhosis, ascites, intestinal tuberculosis, or tuberculous peritonitis. According to Chinese medicine, it is divided into abdominal distension due to vital energy stasis and abdominal distension due to dyspepsia. The former is mostly caused by depression and blockage of vital energy circulation, whereas the latter tends to be caused by too much drink and food and accumulation of food and indigestion in the stomach. The patient should go to hospital immediately for diagnosis if abdominal distension exceeds for over 3 days. It is due to improper diet. The patient can take some medicine for digestion under the guidance of a doctor. Here we have the areas and points to be used. The projection area of the stomach and the small intestine on the body surface. We have the corresponding area of the stomach and the small intestine on the spine. We have CV13, 5 cun above the navel on the anterior midline. The CV10, 2 cun above the navel. And stomach 25, about 2 cun horizontally away from the navel. And CV6, about 1 point cun below the navel. Recommended procedures: projection area of the stomach and the small intestine on the body surface. We use the surface scraping to scrape the areas from up to down. Next, corresponding area of the stomach and the small intestine on the spine. We use the surface scraping and the dual angle scraping to scrape the area from up to down. Next, the Shangwan point, Xiaowan point, Chiha point, and Qianshu point use the surface scraping to respectively scrape the Shangwan point to the Shanwan point and Chahai point on Ren meridian, and scrape Qianshu point to stomach meridian. Therapy to increase the curative effect. Kneading the lower abdomen, the patient lies on his or her back and places his or her right palm on the abdomen, overlapped with the left palm. Then use the thinner eminence and the palm root to press against the abdomen, kneading around navel 50 to 100 times clockwise with a light force that the abdomen does not feel painful and uncomfortable from it. Kneading the abdomen can reinforce the functions of intestines and stomach as well as the muscle of abdominal walls, increase the secretion of digestive juice and the movement of the stomach and intestines, provide blood circulation and digestion and absorption of food. Thank you for your attention.